The Medicare Annual Enrollment Period is almost here again. Every year, from October 15th through December 7th, Medicare plan advertising takes over everywhere. It's impossible to ignore, but it isn't always clear what the annual enrollment period means for you. This video will guide you through what you should do during the AEP, what you can do if you choose, and let you know which Medicare plans are affected by the annual enrollment period and which plans are not. Hi there, I'm Tabitha Moldenhauer, Medicare Plan Broker with Benefit Consultants Midwest. If you haven't already, please take a moment to hit the subscribe button. We have educational content on all aspects of Medicare to help folks who are turning 65 soon and those who are already on Medicare. Which Medicare plans are affected by the AEP? The annual enrollment period occurs every year between October 15th and December 7th and applies to Medicare Advantage plans and Medicare Part D plans, but not to Medicare supplements, which are also known as Medigap plans. What should you do during the annual enrollment period? If you are currently in a Medicare Advantage plan or a Medicare Part D plan, you will receive an annual notice of change by September 30th. Take a little time to review the changes that your plan is making for the new year. Although the whole packet from the insurance company may be huge, there is usually a very clear summary of changes document that's a good place to start. If the changes for the new year don't affect you, you can stay in your plan by doing nothing during the annual enrollment period between October 15th and December 7th. Your coverage will continue in the new year. However, if you find yourself in this situation, it is always a good idea to take a few minutes and look at all the plans that are being released for the new year in your area, just to see if any of them would be a better fit for you than your current plan. Remember, all plans can change every year, not just yours. Different Medicare insurance companies and Advantage plans keep expanding into new areas every year. So it's worth a quick check during the AEP to see what's new where you live. If you read your plan's annual notice of change and find that their changes for the upcoming year will affect you negatively, you should definitely look at other options in your zip code during the AEP. What to look for in your annual notice of change. If you have a standalone Part D plan, check the monthly premium, the annual drug deductible, pharmacy network, is your pharmacy still in your plan's network, and all of your medications. Did the tier level or copay change for any of your prescriptions? Are there any new restrictions on any of your medications? If you have a Medicare Advantage plan, check the monthly premium, any deductible amounts, the maximum out-of-pocket for the year, provider network, are all of your doctors staying in the network for the new plan year, and copay and coinsurance amounts for any medical services that you routinely use or are likely to use in the upcoming year. If you are in a Medicare Advantage plan that includes Part D drug coverage, known as an MAPD plan, you will want to look at all of the above in your annual notice of change. Also, communicate with your doctor's office. Some doctors and medical practices change networks from year to year or decide to only accept certain types of Medicare plans. If your doctor is making one of these changes, you need to know during the AEP. What plan changes are you allowed to make during the annual enrollment period? Number 1, switch from one Part D plan to another. This is very common and easy to do. Part D plans can change every year, so the one that you enrolled in last year or 5 years ago may no longer be the best option for you in your zip code. Enrollments to change are handled over the phone or online and are quick and simple. Number 2, switch from one Medicare Advantage plan, MA or MAPD, to a different Medicare Advantage plan. If changes to your current plan will negatively impact you, or if changes to other plans make those a better option than your current plan, it's easy to enroll in a different Medicare Advantage plan for the new year. Number 3, switch from a Medicare Advantage plan that includes Part D drug coverage to one that does not. If you have creditable prescription drug coverage from some other source, this may be a good option for you. If you do not have creditable drug coverage, this is not recommended. If you have more than 63 days without Part D coverage or creditable drug coverage and try to enroll in a Part D plan or Medicare Advantage plan after that, you will owe a late enrollment penalty for the time you did not have Part D coverage or creditable drug coverage. Number 4, switch from a Medicare Advantage plan that does not include drug coverage to one that does. In this case, you would need to provide proof of creditable drug coverage to avoid paying that Medicare Part D late enrollment penalty. Number 5, switch from original Medicare with a Medicare Supplement and standalone Part D plan to a Medicare Advantage MAPD plan. If the new Medicare Advantage plans are a better fit for you than your current coverage of original Medicare, a Medicare Supplement, and a standalone Part D plan, you can drop your Medicare Supplement and standalone Part D plan to enroll in a Medicare Advantage plan during the AEP. If you choose this option, your Part D plan will automatically be canceled when you enroll in a Medicare Advantage plan with drug coverage, but you will need to request that your Medicare Supplement policy be canceled as of December 31st. Number 6, leave a Medicare Advantage plan to return to original Medicare. If no Medicare Advantage plan works for you for the new year, you can leave your current Medicare Advantage plan and return to original Medicare Parts A and B. However, be aware that you may not be able to purchase a Medicare supplement to cover the gaps in original Medicare Parts A and B. More on that coming up in just a few minutes. Number 7, enroll in a Part D plan. If you are leaving a Medicare Advantage plan to return to original Medicare during the annual enrollment period, you can enroll in a standalone Part D prescription drug plan. Number 8, drop Part D coverage. During the AEP, you can drop your standalone Part D plan. This may be beneficial if you or your spouse has group coverage through an employer that provides creditable drug coverage, which would make your Part D plan unnecessary. Be sure what is provided by the group plan is creditable coverage before dropping your Part D plan. You always want to avoid any actions that would result in you paying a Medicare Part D late enrollment penalty down the line. Those are the things you can do during the annual enrollment period. Whether you make any of those changes on October 15th or December 7th or any day in between, plan changes all become effective on January 1st. One thing to note, generally you can't enroll in a Medicare Advantage plan and a standalone Part D plan at the same time. The only exceptions to that are some private fee-for-service plans, medical savings account plans, cost plans, and certain employer-sponsored Medicare health plans. So what about Medicare supplements? Medicare supplements, also known as Medigap plans, do not fall under the annual enrollment period. These are much older plans that follow different enrollment rules. You can change your Medicare supplement plan anytime during the calendar year. However, in most states and under most circumstances, you will have to answer health questions, provide a list of medications, and pass health underwriting in order to be approved to purchase a new Medigap policy. There are exceptions to that based on state laws, and there are some guaranteed issue Medicare supplement companies that will accept anyone who is age 65 or older and has Medicare Parts A and B. But don't assume that if you leave your Medicare Advantage plan during the annual enrollment period to return to original Medicare that you will necessarily be able to purchase a Medicare supplement at that time. That is definitely something to look into before leaving your Medicare Advantage plan. The health questions for underwriting do vary from company to company, so a Medicare plan broker will be able to assist you in finding a company that is most likely to accept your application, if at all possible, in your area. If you are thinking of leaving your Medicare Advantage plan and purchasing a Medicare supplement during the AEP, start the process early. If you apply for a Medigap plan on October 15th, for a January 1st effective date, which is the earliest you can leave your Medicare Advantage plan, you should have an answer with plenty of time left in the AEP, just in case you also need to apply to another company. What if you have a Medicare supplement plan that you're happy with? Medicare supplements are guaranteed renewable as long as you pay the premium, and their benefits do not change from year to year. You do not need to do anything during the annual enrollment period if you want to keep the Medigap plan that you have. Medicare insurance plan broker communication changes. Two big changes are coming October 1st that are going to apply through the AEP and into 2023. The first change is that all phone calls between you and your Medicare plan broker that discuss Medicare Advantage plans or Medicare Part D plans will be recorded and kept on file for 10 years. The larger call centers for Medicare plans have already had to do this for several years. Starting October 1st, this rule is being extended to independent agents and brokers also. The other change is that a disclaimer needs to be said within the first 60 seconds of any phone call in the enrollment process, and this same disclaimer must appear on all websites and written communication. Here is the disclaimer. We do not offer every plan available in your area. Any information we provide is limited to those plans we do offer in your area. Please contact Medicare.gov or 1-800-Medicare to get information on all of your options. Here are a couple clarifications on that disclaimer. First, Medicare.gov is one of the tools we use when we are working with you to compare all plans available in your area. Also, the other tools that we use to compare plans with you allow us to show not just the plans that we have contracts with, but all of the plans in your area. So we are never hiding any available plans from you. We contract with most Medicare plans. There are some insurance companies that don't sell their Medicare plans through independent agents and brokers, so we can't be contracted with those. In the rare instances when the best plan for a Medicare beneficiary is one of the plans that we don't contract with, we tell the beneficiary that. Being honest with everyone who calls us is why we've been in business for more than 45 years. Have questions? We can help. For answers to your specific Medicare questions and to objectively compare all available Medicare plans where you live, please feel free to call our office at 877-312-1414 or schedule a free, no obligation Medicare plan consultation using the link in the description. Our services are always free, and enrolling through our office does not increase the cost of any insurance purchase. Have a great day.